All right, today we're opening up the Caregiver's Toolkit. And I want to be clear, this isn't just about a list of chores, right? It's really about a set of skills that are all focused on providing care with dignity, comfort, and, of course, safety. So let's get right into it. You know, this quote really gets to the heart of it all. It's the core idea behind everything we're about to cover. It doesn't matter if a procedure is simple or complex, it has to be built on this foundation of empathy and just genuine respect for the person you're caring for. So that's the big question, isn't it? Where do we even begin? Well, before we jump into the nitty-gritty of specific tasks, like denture care or making a bed, we first have to lay down the ground rules. These are the rules that apply to every single interaction you have. Okay, so this next part, I want you to think of it like the operating system for great caregiving. Seriously, these are the universal principles that are always running in the background, no matter what specific program or task you happen to be doing. So it really all boils down to these main pillars. You've got dignity, safety, and infection control. And hey, pay attention to that last point there. Every single task has what we call initial and final steps. That structure is absolutely key for making sure everything is consistent and safe every single time. All right, let's move on and grab our first set of tools from the kit. We're talking about grooming. And listen, this is so much more than just cleaning. When you do it with respect, it becomes this incredibly powerful way to help restore a person's sense of self. That feeling of normalcy. Denture care is just a perfect example of all these principles in action. Let's look at the why behind these steps, because that's what's important. Why do you line the sink with a towel? Well, it's to protect the dentures if they happen to slip, a super simple but totally crucial safety measure. And why do you always inspect the mouth? Because that quick check can reveal the very first signs of health issues that need to be reported right away. Okay, let's talk about shaving. The big thing to remember here is that the tool you use completely dictates the technique. So, if you're using an electric razor, the most critical thing is safety. Never use it in your water, oxygen, or with certain pacemakers. But if you're using a safety razor, the key is all in the prep. You want to use warm water to soften the skin, and then, this is important, shave with the grain. So that's downward strokes on the face and upward strokes on the neck. That's how you prevent irritation. When it comes to hair and nail care, it's all about two things, comfort and choice. For hair, here's a great tip. Always start combing from the ends and then gently work your way up to the scalp. It's the absolute gentlest way to get tangles out. And of course, always ask what products they'd like to use. It's their hair. Then for nails, soaking them in warm water is key. It really softens them up. After that, you'll want to clip straight across. That helps prevent any skin damage. And then just file them into a nice, smooth curve. Okay, now we're going to shift gears a bit and move into some more personal procedures. And this is where a caregiver's professional, respectful approach becomes absolutely paramount. It's all about preserving a person's dignity. This next one, it's a simple but honestly brilliant rule for helping someone get dressed. You always start with the affected or weaker side first. Why? Because it minimizes any painful movement or stress on their joints. And when it's time to undress, you just do the exact opposite. Start with the stronger side first. It's such a small detail, but believe me, it has a huge impact on their comfort. This quote, wow, it just perfectly captures that delicate balance you have to strike when you're assisting with something as personal as toileting. It's this constant dance between creating a space of dignity and independence, while at the same time always being present and ready to make sure they are completely safe. So, there are really 4 key principles to keep in your head for this task. First, proper positioning. That's for comfort and to prevent spills. Second, privacy. That's a fundamental right. Give them the call light and step away if it's safe. Third, hygiene. Wiping front to back is so critical for preventing infections. And finally, and this is a big one, observation. The crucial point here is that you always look before disposing of any waste. That quick observation is a vital health check. All right, we've now arrived at a task that, on the surface, might seem super simple, just making a bed. But in a professional care setting, this is actually a high-skill procedure. A properly made medical bed isn't just nice to look at. It's absolutely essential for a resident's comfort, their safety, and even for preventing serious health complications. I have to say, I absolutely love this analogy from our source material. It compares making a medical bed to parallel parking, and that just captures the experience perfectly, doesn't it? You might think you know how to do it, but to actually execute it correctly, that takes practice and a lot of precision. Being just a couple of inches off can make a huge difference. Okay, so with that in mind, let's really focus in on the two most critical and honestly most often tested details of that parallel parking process. And remember, these techniques aren't just about making the bed look neat, they are actual safety features designed to prevent harm. First up, we have the mitered corner, sometimes called a hospital corner. It's that series of folds that creates a really tight, clean finish. Yeah, it looks neat, but that's not the main point. Its primary function is all about safety. It secures the linens so tightly that the resident's feet can't get tangled up, which is a big deal for helping prevent falls. The second key technique is called the toe pleat. It's just a simple little fold you make at the foot of the bed right after the top sheets are on. So why does this little fold matter so much? Well, this one small action creates a kind of tent of space for the feet. It relieves that constant weight and pressure from the blankets, and that is a major factor in preventing painful and even dangerous pressure sores. Okay, so we've covered a lot of the hands-on physical tasks. Now let's shift to what might just be the single most important tool in the entire toolkit, your attention. See, a great caregiver isn't just someone who does things. They're an observer. They are a vital partner in the resident's overall healthcare team. This right here is the core takeaway. When you are present and truly attentive during all these routine, day-to-day tasks, you become the front line of detection. You are the person who is most likely to spot those tiny, subtle changes that can signal a developing medical problem long before anyone else. And this table here basically pulls it all together. It shows you exactly what you should be looking for. Remember when we talked about denture care? You're looking for sores. And during nail care, you're checking for any discoloration. After assisting with toileting, you're noting any changes. Every single one of these observations is like a data point, and these data points can lead to crucial early medical intervention. So look, if you take just one single thing away from all of this today, please let it be this. The physical skills, they're learnable, and they're absolutely essential. But it's your mindful presence, your careful observation, and your incredible attention to detail that is what elevates caregiving from just a series of tasks into a truly protective and healing art. And that leaves us with one final question to think about. It doesn't matter if you're a professional caregiver or if you're just looking out for a loved one. What's one tiny detail, a dry lip, a tangled sheet, remembering their favorite hair product? What's that one small thing you can notice today that will not only ensure safety, but will make someone feel truly, deeply seen and cared for?